It's wonderful that you bring all that up, and especially those other points. That's not just mercury; it's all metals. Or oral galvanism is a
Yeah.
serious thing, right? That's what it's called. I learned about that years ago, and if you want to learn more about exactly how that works, you can read Dr. Nischwitz's book here. But taking out too quickly also is not something that you would advise, or doing it improperly. And let me give you just a quick story, because we have a physician assistant who works here at the clinic, and she used to be a patient. She had Lyme disease, mold toxicity, and also heavy metal toxicity. And she had a number of mercury amalgams. And the doctor, who was just I don't think he was a functional doctor, but said, you should remove them. Your mercury is high. Let's just take them out. And so sent to another dentist who just took them all out, no real precautions or anything. And she said that exacerbated it totally. That's when she got really bedridden and said, oh man, maybe I shouldn't have taken these out, not knowing what was going on. But can you go into that? Because many people think, like, they're hearing this and they're like, okay, let me take these all out. Let me just go to a dentist and make them do it, even though they don't understand how to do it. So go
Yeah,
into that a little bit.
yeah, perfect story. And this is the bread and butter of a lot of patients I was seeing for the last years. In the realm of chronic disease, Lyme, mold, this is all connected to the heavy metal problems. Yes, it needs to be timed wisely. And for now, don't panic and don't just go to any dentist and just drill out the amalgams. Why? Because then it's for sure that you will uptake way, way, way more of the mercury vapor that you would have by just having the amalgam fillings in your mouth. You need to find a skilled dentist who is able to remove all the metals, not just the mercury fillings, all the metals under special precautions, safe removal strategies. I recently posted a safe amalgam checklist in my feed on Instagram so that you can just go with it to your dentist. And we need there are a few things that are, so what we need to achieve here is we don't want any patient uptake more mercury that he already had before. This is the goal of drilling out the amalgam fillings. We could do it in a pregnant woman, but we don't do it. But because of the measurements, it would be possible if it's life-threatening. Okay, this is how strict you have to be. And we need a few things to make sure that we don't take more mercury. So obligatory, a rubber dam, which is not against the mercury vapor. Mercury vapor goes through 7 layers of latex gloves. So rubber dam won't help. But rubber dam helps with the bits and pieces and the particles. But most of the time, a biological dentist will not drill out, but only break out the filling if possible. Yeah, to further reduce the chance of the vapor. Then we have a special suction going over the tooth. If this is your tooth, it goes over like this, and inside of suction is kind of like a, what is this, like a turbulent suction.
A fan kind of a mechanism?
Kind of like it makes this thing so that it's a Scandinavian device called Cleanup.
Okay.
You can find it in probably all the dental distributors. And it takes about 99% of the mercury vapor already. And we also have a nasal probe where we just bring in fresh air. We don't do oxygen anymore because this was earlier. It's now clear that we need fresh air. It's better. Otherwise, it could be oxidized. And we have a big, basically it's an air clean filter system. It's called IQ Air. It's like a huge tube. Looks like an oven tube. It's loud and noisy, but it has I would say it's like 12 centimeters of diameter. And it goes pretty close to the mouth of the patient, but also through our surgeons or dentists. And again, takes about 99% of the vapor into the system, which purifies already everything in your office. Of course, the dentist needs to wear an FFP3 mask, that's for sure, or gold mask, whatever. And then obligatory, this was obligatory, but no mandatory. But optional, we use, of course, we do a lot of IV nutrients before, during, after surgery, of course, before, during, after amalgam removal. And we try to remove the amalgam fillings or the metals in as less sessions as possible. Best in 1 day if possible. Why? Because we have all the special precautions and we don't want to have your immune system getting allergic by being multiple times in a row, like getting into contact with these things, because you're never sure if you get 100%, but we make sure to try 99% at least of the vapor with our things. Then we do chlorella paste in the cavity if the if the filling is out. Let it sit there for a while to just get the dentin tubules a bit cleaner and the tooth itself. Then we most of the time just place a temporary filling to let the tooth get a little rest, like to let it detox a bit in both directions. The temporary filling is made out of glasionomeric cement, which is kind of hypoallergenic before we do any sort of definitive crown work. And yeah, this is kind of like the overall picture. There are a few more things that you can do for sure, and that we all do, but this is probably the most advanced thing. And I think if you go to in the US for safe amalgam removal, safe amalgam removal, biological dentistry, IAOMT is probably the place to start. It's not the same training we have, but I know with the amalgam that works, and this is where you should look into. Like, don't just go to dentist and let it drill out. This can do. Actually, this is for a lot of people where everything, like you said, exacerbates. What did you say?
Exacerbates, yeah.